data are only as good as the questions we ask, they're only as good as the lens we take on them, and they're only as good as us being able to extract meaning from those data. So in some respects, having so much more data available and so much more data available quickly poses a real challenge, because it can be a tsunami of data. And there are enormous data sets that are publicly available. So I think the next step challenge is how to take those data and to generate meaning from them. I think we're going to be able to capture people's state of being, state of living, the context in which they live throughout their whole life. We're going to be able to have data that essentially creates a history of our existence, which can give us tremendous insight into what generates a person's health. And I'm hoping that we'll also have data that shows the nested context within which we live, the data that is able to connect us to our networks, to our cities in which we live, to our countries and those policies. If we can create data that is longitudinal, which is over our life, starting from neonatal period to childhood, all the way to adulthood, all the way to older adulthood, and we can have data that is nested, that shows me within my immediate context, linked to my network, linked to my city in which I'm in, and understanding the forces that are both within networks, within levels, and also over time. I think that can give us a much richer understanding of what generates health for any individual throughout her life course.